Today, we will learn about hepatic steatosis, or fatty liver disease. It occurs when too much fat accumulates in liver cells, which can cause health problems. We will discuss its causes, effects, and possible treatments. Let's get started. This section of the video focuses on the formation, expansion, and turnover of lipid droplets in hepatocytes, and their role in hepatic steatosis. We will discuss the proteins and enzymes involved, as well as the factors contributing to the development of this condition. In this section, we will delve into the intricate connection between the gut microbiota and hepatic steatosis. We'll explore the role of gut dysbiosis, bacterial overgrowth, and the production of bioactive metabolites, all of which contribute to the development of this condition. We'll also discuss how the gut microbiota affects hepatic lipid metabolism, inflammation, and insulin resistance. This knowledge is crucial for developing new treatments and identifying early diagnostic markers. In this section, we will discuss the harmful effects of excessive lipid accumulation in liver cells, known as lipotoxicity. This process can lead to liver injury and disease progression. We will explore the intricate molecular mechanisms, such as the accumulation of lipid metabolites, stress in the endoplasmic reticulum, dysfunction in the mitochondria, and the activation of inflammatory pathways. These processes contribute to hepatocyte injury, cell death, and the progression of hepatic steatosis to more severe liver diseases, like non-alcoholic steatohepatitis, NASH, and liver fibrosis. Understanding the cellular consequences of lipotoxicity provides insights into the development of hepatic steatosis and potential therapeutic targets. In this section, we will discuss the potential of fibroblast growth factor 21, FGF21, and its analogues in treating hepatic steatosis. FGF21 can improve insulin sensitivity, reduce fat in the liver, and address metabolic abnormalities associated with this condition. We will delve into the molecular mechanisms, ongoing clinical trials, and challenges of using FGF21-based therapies. This knowledge will expand our treatment options for hepatic steatosis. In this section, we will explore the relationship between viral hepatitis infections, such as hepatitis C, and the development of hepatic steatosis. We will examine how viral hepatitis promotes lipid accumulation in the liver and its impact on disease progression, treatment response, and liver transplant outcomes. We will also discuss strategies to minimize the negative effects of hepatic steatosis and improve transplant outcomes. In this section, we will explore how pre-existing hepatic steatosis affects liver transplant outcomes. We will analyze the impact on graft survival, post-transplant complications, and strategies to minimize the negative effects. By understanding these challenges, we can improve patient selection and long-term survival. Iron overload disorders, like hereditary hemochromatosis, are linked to hepatic steatosis. We will explore the mechanisms and possible treatments, including how iron overload disrupts lipid metabolism and promotes liver injury. Understanding this relationship will guide therapeutic interventions for patients with these conditions. In this section, we will discuss the risk factors, molecular mechanisms, and surveillance strategies for hepatocellular carcinoma, HCC, in non-alcoholic fatty liver disease, NAFLD. We will explore the development of NAFLD-related HCC and ways to detect it early for better patient outcomes. In our video, we will discuss how the gut and liver interact in the development of hepatic steatosis. We will explore treatment options like prebiotics, probiotics, fecal microbiota transplantation, and bile acid-based therapies to improve gut-liver communication and reduce liver fat. Now, let's shift our attention to the current and upcoming pharmacological interventions for the treatment of non-alcoholic steatohepatitis, NASH. NASH represents the progressive stage of hepatic steatosis, characterized by liver inflammation and fibrosis. We will review the current arsenal of pharmacotherapy options targeting inflammation, fibrosis, and metabolic pathways implicated in NASH pathogenesis. Additionally, we will explore the investigational drugs and therapeutic strategies currently in development, such as farnesoid X receptor, FXR, agonists, peroxisome proliferator activated receptor, PPAR, agonists, and antisense oligonucleotides. Understanding the mechanisms of action and potential benefits of these pharmacological agents will enable us to make informed decisions in tailoring treatment regimens for patients with NASH. Our video will discuss the connection between hepatic steatosis and cardiovascular disease. We will explore shared risk factors, mechanisms, and clinical implications. This knowledge will aid in developing effective treatment plans for patients with both conditions. In our final topic, we will investigate the role of epigenetic modifications in the development and progression of hepatic steatosis. Epigenetic changes, such as DNA methylation and histone modifications, can dynamically regulate gene expression patterns and contribute to the pathogenesis of this condition. We will explore the epigenetic alterations associated with hepatic steatosis and discuss their functional consequences on lipid metabolism, inflammation, and fibrosis. Furthermore, we will examine the potential of targeting epigenetic modifiers as a therapeutic approach for hepatic steatosis. Understanding the impact of epigenetic modifications in hepatic steatosis will provide us with valuable insights into disease progression and open up new avenues for therapeutic interventions. In summary, we have covered the various aspects of hepatic steatosis, including its molecular mechanisms, clinical implications, and potential interventions. Understanding this complex condition will help us develop effective strategies to improve patient outcomes.